Caffeine can improve athletic performance, but more is not necessarily better. In the next few minutes, I will explain what caffeine is, how it may benefit basketball players, its potential disadvantages, the NCAA's rules, and how our athletes can use it responsibly. Caffeine is a central nervous system stimulant that primarily works by blocking adenosine receptors in the brain. Adenosine normally contributes to fatigue and sleepiness. By limiting its effects, caffeine can improve alertness and make exercise feel easier. Common sources include coffee, tea, soda, energy drinks, pre-workout supplements, gels, gums, and tablets. Ingredients such as guara and yerba mate also contain caffeine, so athletes should remember that multiple ingredients in one product may contribute to its total caffeine content. For basketball players, caffeine's potential benefits are not limited to endurance. Research suggests that it may produce small improvements in repeated sprinting, movement velocity, muscular endurance, strength, jumping ability, attention, and perceived exertion. These effects may benefit trained athletes during games, demanding practices, or performance testing where repeated explosive movements and quick decision-making are important. However, responses vary considerably. Some athletes experience noticeable improvements, while others receive little benefit or develop unwanted side effects. Caffeine also has disadvantages. Potential side effects include anxiety, restlessness, gastrointestinal distress, headaches, elevated heart rate, and sleep disruption. Caffeine has a long and highly variable half-life, meaning it can remain active for several hours. Therefore, caffeine consumed before an evening practice or game may still interfere with sleep afterwards. This is an important trade-off because inadequate sleep can undermine recovery, learning, and next-day performance. Higher caffeine doses also increase the likelihood of side effects without necessarily producing greater performance benefits. Under the NCAA's 2026 to 2027 drug testing policy, caffeine is included in the banned stimulant class. However, the NCAA defines a positive result as a urine caffeine concentration of 15 micrograms per milliliter or greater. Athletes should not treat this threshold as a dosing target or guarantee of safety. Energy drinks and pre-workout supplements create additional risks because of their caffeine amounts may vary and they may contain banned stimulants. Examples are listed down below. The NCAA does not approve dietary supplements, and athletes are responsible for every substance they consume. Research commonly supports approximately 3 to 6 milligrams of caffeine per kilogram of body weight about 60 minutes before exercise. However, lower doses can still be effective. For our team, athletes should begin with 1 to 3 milligrams per kilogram during a controlled practice rather than trying caffeine for the first time before a game. Athletes should record how it affects their performance, side effects, and sleep. Do not stack coffee, energy drinks, and pre-workouts or use caffeine automatically before every session. Every supplement should be reviewed by our sports medicine and compliance staff. Third-party testing may lower the risk of contamination, but it cannot eliminate risk. The practical takeaway is simple. Caffeine can provide a small but meaningful performance benefit. However, it should only be used when the athlete responds well, the timing does not interfere with sleep, and the product complies with NCAA policy. Caffeine use should be individualized, tested before practice or tested during practice, and approached with the same care as any performance strategy. When in doubt, bring the product to our sports medicine and compliance staff before using it.